I'm at VisualSonics. I want to thank everyone for joining us this morning in Toronto. I'm not sure what time zone it is for the rest of you, but I do appreciate you taking the time to join us and hear about our VevoStrain software. I want to make a few quick notes about the running of the webinar. There will be a recording of this webinar made available. So if for any reason you'd need to hear a replay or you aren't able to stay for the duration of the talk today, there will be a recording emailed out after the session today. All of the lines, if you haven't noticed, they are muted. This is to eliminate all of the background noise out in the field. So if you do have a question, please use the chat window at the right of your WebEx screen for questions. We have a team of people here that can respond to any problems you're having and help try to rectify those issues to make today's session go as smoothly as possible. We'll be answering questions at the end of the presentation. There will also be an interactive session where we see some of the VevoStrain software in action. We'll also take questions at the end. Please feel free to answer or ask questions at any point during the talk through the chat window. We'll record them here and then can follow up with you at the appropriate time. The expected duration for today is approximately 40 minutes altogether. We're expecting about 30-35 minutes for the presentation components, and then plus some questions will run about 40, perhaps 45 minutes. And just, if you aren't able to stay on for the duration of today, we do want to remind you right now up front that there are webinars on a continuous basis from VisualSonics, visualsonics.com/webinars. So at this point, I would like to pass things over to Stephanie Schaefer. She is one of our applications specialists focusing on VevoStrain software, and today she'll be showing you many exciting applications and the use of VevoStrain that can be applicable to your research. So thanks very much, Stephanie.
Hey, Andrew, and good morning, everybody, and thanks again for joining us early today. So we're going to get started. So first I'm going to go through a brief presentation and cover a couple of topics. And so to begin, I'll be looking at points of interest. So we're looking at conventional measures versus the VevoStrain solution that we offer. I'll discuss what is VevoStrain, so give a brief definition and what that means. Then I'll go over some recent publications that have come out using our software, provide applications and workflow. In the portion of the presentation, I will touch on image acquisition, so just a few pointers or tips to help you acquire an image that'll help you use the software. And then finally, I will go through the software demonstration. Okay, so to get started, I'll discuss the conventional measures versus the VevoStrain solution. So as most of you are probably aware, there's the conventional LV trace tool that is available. This is an excellent tool when you're looking at assessing cardiac function, so such as ejection fraction, fractional shortening, stroke volume, and cardiac output. So what this tool does is it looks at the changes in chamber volume, and this is sensitive to the overall changes in cardiac function. So if I can bring you to look over at the video playing over at the right is an example of an infarct model. So as you can clearly see with the infarct model, there is an area which is present, the muscle that is actually not moving due to the infarct. But there's also the other regions of healthy muscle that are continually pumping hard to pump out that blood to the rest of the body. So sometimes these values can actually still come out as normal ejection fraction or fractional shortening values, even though it's clear that heart failure is occurring. So this is where I bring you into the strain analysis. So analysis is a direct measurement of muscle contractility. It detects subtle changes in cardiac muscle performance. For example, what the strain analysis does, it can detect earlier dysfunction than the conventional tool. So, for example, a publication by Bauer, he was able to use our VevoStrain software and detect these changes earlier than the conventional tools. So strain and strain rate is actually used in the clinic today. And strain is a valuable tool because it can look at cardiovascular disease, cardiac regeneration, cancer therapeutics, drug development areas. What strain is, it sensitively monitors cardiac function and ventricular remodeling. can detect early signs of cardiotoxicity and anti-cancer therapy. So for example, with a lot of cancer drugs, they will have an effect on the heart. What strain does, using strain can actually detect these changes earlier than some other conventional tools. So what are VevoStrain software? Our VevoStrain software is an advanced cardiac analysis tool that is used, again, to detect early cardiovascular dysfunction. And what it's focused on is assessing wall motion abnormalities, wall synchronicity, and cardiac mechanics. So here at VisualSonics, our VevoStrain software is actually the only software analysis tool that is commercially available to study small animals. So the software actually is designed to go with our Vevo 2100 system. Both our Vevo 2100 system together with the strain analysis is unparalleled in terms of accuracy and reproducibility. Most of you already know the heart contracts in more than one motion. So it contracts in both circumferential, radial, and longitudinal axis. With this software, the software looks at myocardial abnormalities in all three different axes, and can look at 4 parameters can be quantified, such as velocity, displacement, strain, and strain rate. So what is strain? So strain is the deformation of tissue. You can have a tissue at a beginning length, for example, if it's in diastole, and as that tissue as the heart becomes in systole, that tissue will then stretch. You can put this into the numbers into the following equation, and you can get percent strain. So example of the heart as it's moving from systole to diastole. So that change in length can be calculated as strain. If we put 1 in L0 and 1.5 in L, for example, the strain would be 50%. So what is strain rate? Strain rate is the deformation per unit of time. So how fast is this tissue deforming? And also derived from an equation, strain rate equals delta L over delta T equals S to the negative 1. So you have two areas of tissue that have the same percent strain, but they can actually be changing at different rates. What our software can help analyze. When you're using our VevoStrain software, if you are acquiring an image in the long axis view, you can acquire longitudinal and radial data. Now, if you are in the if you're in the short axis view of the heart, that's what's going to give you both circumferential and radial data. So this is an example of what the traces look like when you're beginning to use the software. So when you use your trace, you can clearly see you use your B mode, or your B mode image. We have the long axis view in place. We've traced both the endo and epicardial walls. So what trace does is it follows the movement, as you can clearly see in the video, the contraction of those walls, both endo and epicardial trace. Now, over at the right-hand side here, we've placed in the video along the axis vectors. So you can actually track the movement of each point placed along the endocardial wall. So the software also allows you to analyze either global motion or regional motion. So what we've done here in this example is we've placed a blue dot at the interior wall. We've also placed one at the apex. So if you choose to look at certain areas that you want to analyze, you can place those points along the endocardial wall and just track those points specifically to collect data. Software also allows you to analyze something called time-to-peak analysis. So what the peak looks at is synchronicity of all of the walls. Software will divide the regions of the walls up of the myocardium, and you can look at how in sync each wall is during contraction. So as mentioned, you can look at regional motion. So this is an example of an infarct model, a heart, that we've placed a point in the healthy region. So as you can see, there's the blue point that's been placed in the healthy region of the heart. And you can see the red point that's been placed at the infarct region. So you can clearly see the difference in the motion and the movement between those 2 points. And you can look at those differences in velocity, displacement, strain, and strain rate. I'll briefly talk about some recent publications. So as you can see on the front of Circulation Research, our VevoStrain software was on the front cover. So we looked at the Bauer paper, and what the Bauer paper looked at was strain analysis of the left ventricle remodeling in a mouse of a myocardial infarct model. So what they did is they looked at strain and strain rate, and using the software, they were able to detect discrete changes in the myocardial contractility. So here are some of the results that they had in the paper. So they looked at longitudinal strain and longitudinal strain rate, and they found clear differences between their 2 groups. Another paper that came out using our software was with respect to a transaortic constriction model, or a TAC model. So in this paper, they used a mouse model, the placental growth factor knockout model, and it was shown to have greater decrease in strain and strain rate 6 weeks after surgical placement of the TAC suture compared to the wild type. So this paper looked at, they compared strain, displacement, and velocity between the 2 groups. And they found clear differences between the 2. And the third paper is out on atherosclerosis model, and here they used our software to look at longitudinal motion. And they found in the mouse model that the longitudinal motion is decreased in the carotid arteries with a high plaque burden. And this was a paper that was looking at the translation to man from human to mouse. Now, our software also provides a parametric map. What this map does is it displays both systolic and diastolic changes, and can be looked at in both the long and short axis. So, as you can see here, this is what the parametric map will look like on the analysis screen. It tracks both systole, found in the red, and diastole movements. The parametric map can then be converted into 3D, which you can see on the left, and this is what was on the front of the circulation paper. So how this 3D model can be used is to show you the differences in motion at different areas of the heart. This is an example of an infarct model, and it's taken its 3D image, and here you can clearly see the differences in velocity in the parametric map. So some brief conclusions. So VevoStrain software is an advanced cardiac analysis tool. It's very easy to use, it's very accurate, and can provide you with reproducible data. It enables post-processing quantification of the myocardial wall abnormalities. Again, you're looking at circumferential, radial, and longitudinal motion. So at this point, I'll briefly stop and see if there's any questions at this point.
Okay, thanks, Stephanie. Are there any, from many of the listeners out in the field, are there any questions at this point before we move on to the more demonstration portion of the webinar? I don't see any questions right now, so why don't we let Stephanie continue. If you think of more questions or any questions while we continue, we'll have another period at the end where we certainly take some questions.
So I'm going to start demonstrating our VevoStrain software. So to begin the analysis, what you first want to do is select a B mode SynLoop from the study browser. So in this example, what I'm going to do is I'm going to select the long axis of the heart. Okay, so this is the image that I want to analyze with our strain software. So to begin, I'm just going to stop the SynLoop from playing. Okay, and it doesn't matter at which point you stop the SynLoop from playing. Then I'm going to move over to the measurements. So I click measurements. So to load this image into the software, the VevoStrain package will be found up the left-hand corner. So I'm going to click VevoStrain. So then you'll notice the image is now beginning to be loaded into our software. So this is what the beginning looks like. So what you're going to do is you're first going to use your anatomical M-mode tool to begin a trace to look at picking your different cardiac cycles for analysis. So this is my anatomical M mode tool. Before I'm going to do this trace, I want to bring you over to the gamma slider here. This gamma slider can be adjusted to adjust the gain of your image. So if you want to adjust that gain to see the walls a little bit clearer, you can do that. So now I'm going to begin the trace. So what you want to do is left-click on the image of the anterior wall of the left ventricle. Click above the anterior wall using your left-click button. You're going to drag the cursor down and pull past the posterior wall. Then to end, you're going to right-click. So now my cursor, my tool is free. So you can see at the bottom here is clearly the anatomical M mode of my left ventricle. And it's showing me the different cardiac cycles. This is now where I'm going to want to select the cycles for analysis. But there's an important note to look at is you'll want to avoid any areas which you know the animal has taken a breath. So as you can see in this image here, there's a little bit of distortion at this section of the M mode and here as well. What you know is this is where the animal has taken a breath. So I'm going to want to avoid analysis in this area. So to use my cycles, what I want to do is select the red sliding bars. As I pull these bars over, I'm going to be selecting the cycles I wish to analyze. So I'm wanting to avoid the breath of the animal. And you take the one on the right-hand side, and the same thing. Now, when this image was taken, the respiration rate was quite high with this animal, so it looks like for analysis in this case, I'll only be able to look at one cardiac cycle. But we do recommend using between 2 to 3 cycles for whatever is going to suit the image that you've acquired. Nothing else to note is automatically you'll notice that R waves have been placed for me, both here and here, and throughout the entire M mode. Now, for example, if I'm unhappy where these have been placed, or I didn't get an ECG signal from my image acquisition, I get something called delete R waves. So they've been deleted. What this will do is give me the option to select those R waves myself. So I'm in a place where I feel the R wave is best suited. So it's where I can select on my own. If I want to restore these R waves, what I hit is restore detected R waves and returned. So if you're happy with the cycles you've selected and the R waves that are present, you can then hit the next button. Okay, so this is what it looks like. The software begins to look like. But first we have to let the software know what axis of the heart are we in. So I'm choosing long axis. So here's the SYN loop that I'm going to play here. So this is the SYN loop playing the selected cycles from the previous screen. So this is where I want to find select an area through the SYN loop that I want to begin my trace. You can scroll through the SYN loop and find where you can see the walls the clearest. Now, it does not matter if you're in either systole or diastole. As long as you can see the walls clear, you can begin the contour trace. So to begin the trace, I'm going to want to trace the endocardium, and I'm going to do this by left-clicking, placing points. So I'm placing points along the endocardium. I typically recommend placing about 12 to 13 points. To end, you're going to want to right-click. Now, for example, let's say I want to find out, am I happy with where I've placed my points in the trace? I want to go over to the Start Analysis button. It'll begin to calculate. Okay, so this is what the analysis screen first looks like. So I'm looking at my trace over at the left-hand side, and say I'm unhappy with a point. I'm happy where I placed this point, so I want to remove that point. That can be done by going over to the right-hand side and going to your Edit Trace tool. So it's like a little pencil with the trace. So to erase a point that I've placed, I can go over that button, go over that trace, and I can right-click. Now, point is gone. So the next portion of the analysis you'll want to do is now select your epicardial trace. And this is done by selecting the endo-epi option that is over at the right-hand corner. So once you select that, automatically the epicardium trace is going to be placed. Now, if you want to increase or decrease the placements of these points, this can be done with the green arrows here. As I increase it, they've increased, and I can decrease those as well. Now, I also have the freedom of moving points individually. So if I want an even more accurate trace, I can take those points by left-clicking over each point and adjusting those to follow the trace more accurately to what I feel is a better trace. So if I'm happy with where I've placed my points, then I can hit the analysis tool. Okay, so we're back at our analysis screen. So I'll walk you through the analysis screen and kind of identify the different areas and what they represent. So I'm just going to put my Cine Loop on pause because it's a little distracting. So when you first open the analysis tool, what you're going to see on the left-hand side is your B-mode image with your trace. Now located at the top is where you can select your different parameters. So for here, we've selected velocity. You can also select displacement, strain, or strain rate. Now, this example, I'm just going to stick with velocity. You'll notice you'll have the radial velocity, which will be shown in the graph at the top here, indicating radial velocity of the endocardium. Longitudinal will be found at the bottom here. You have two parametric maps located showing you both radial velocity and longitudinal velocity. And over at the left-hand side, you'll notice this graph. It can show you the volume of blood in milliseconds over in time. So the amount of blood in the left ventricle at different points in time. So the analysis begins with showing you tracking all 48 points. So if you look at the top here in the radial velocity, you'll notice all of these blue lines. There's multiple blue lines. Tracking all of the 48 points that have been placed on the endocardium. Now, for example, I mentioned that you can also do radial velocity. So just look at, you can look at regional movement. So if there's a certain area that I just specifically want to analyze, I can do that by choosing points either on the Cine Loop itself. So I can place points here by clicking all through the contour. Also, if I want to place points, I can do this by scrolling down the parametric map. So as you notice, as I pull down the parametric map, there are all these little green ticks on the left-hand side. These are each of the points. So if I want to start to place points in a certain area, I can do that as well by left-clicking on the parametric map. And I'll start to play the Cine Loop just to give you an idea. So say I'm unhappy with where I've placed my points, or I want to start over. I can do this by taking my cursor over the parametric map, right-click button, and go to Reset Points. And so all of those points are gone, and now I'm again tracking all of the 48 points. So I'm looking at global movement in the endocardium. So I also draw your attention to the parametric maps. So as mentioned before in the presentation, you're looking at systolic and diastolic changes. So the red is indicating systolic. As I move my cursor over, and you can actually follow this through the Cine Loop, now I'm looking at diastolic changes. Now there's another thing to note when looking at the parametric map is that it goes from a darker region of red to a brighter region of almost white. And that same thing goes with the diastolic or the blue region. What I can do is I can place points in this region that seems to be of a brighter white color. Notice I'm placing points in this region. Those points are going on the left-hand side on my contour trace. What this is telling me is in the heart, on the endocardial wall, that this area is experiencing the highest velocity. Those regions that appear more bright white those are reaching more of a peak at velocity. So those regions have the highest velocity. And the other thing to note is as I place those points, you'll also notice in radial velocity and longitudinal velocity, we're not tracking globally. We are looking at all of the points that I've placed and collecting data just for those points. I'm going to reset those points. So the next thing I want to bring to your attention is the vector button. So over at your right-hand side, you can press the toggle contour vector orbit line or B mode. So what this is going to do is place those vectors on the endocardial wall. And what it does is it's displaying the movement of each point, of the 38 points that are along that contour. I toggle through this button to change the different types of vectors that are being displayed. Also use the up arrow button here, and what that's going to do is it's actually going to increase the vectors. So I can toggle through and show that. So here we go. So see how big the vectors are. I can do it by using the increase arrow button. If I decrease those, I can decrease them using the button on the left-hand side. So those are going to now decrease. Now if I need to reset those, I can just hit the middle button with the blue arrow, and it says reset vector size. So they've been reset to its original movement. Okay, so the next analysis point I want to bring up is the time to peak analysis. This tool is found over on the right-hand side, and again, once you place your cursor over, it'll say time to peak analysis. You click that button. Actually, your analysis screen, your time to peak analysis screen will come up, or it's also known as the secondary analysis screen. So what this screen is showing you, as I mentioned, is time to peak. So it's looking at wall synchronicity. So how in sync are all of the walls of the myocardium? You'll notice you're, again, tracking radial velocity in this graph and longitudinal in the bottom one. You'll see that every line has a different color. This corresponds to the different regions over on the left-hand side of the heart. So, for example, if I look at this pink line, and I've tracked that is corresponding to the pink region located on this area of the heart. Follow the yellow line here, and corresponding to this region of the heart. You'll also notice that there are numbers placed in each region. What it's telling you is time to peak. So it's telling you at what milliseconds does that region of the heart reach its highest peak. So for example, another thing to look at here is the legend in the center. This is a color-coded legend. As you can tell, each section, again, in the center is color-coded from a darker blue to a lighter blue. This corresponds to the legend in the center. You'll note it goes from 0 milliseconds up to 113. And it goes from a dark blue and fades into a white and then a red. So that's when you is coloring the different regions of how many milliseconds that area peaks. So when I look at this portion of the heart, I notice it's darker in blue. I know that this area is peaking before, example, this region of the heart, which is a lighter blue. This information is found over on the right-hand side in the table. It gives you information in time to peak in centimeters per second, as well as time to peak in milliseconds. So it gives you each region of the heart separately, and that again is all color-coded to the lines that are found in the graph. If you either separately or you can find an average, you'll also notice there's something called maximum opposing wall delay. So what that is it displays the differences between the highest and lowest values of the segments of the heart. So it's comparing top to bottom. And there's also underneath something called phase. So it's illustrating phase of the heart. So when phase is the heart? When phase is calculated, it looks at an average. So you can see this black line that's found throughout both graphs. That average that is taken between all regions of the heart. If the regions of the heart peak before this average, they'll be shown in negative values as well as percent. If they peak after, they'll be illustrated in positive values. I also want to bring your attention to something called reverse peak. So if you're interested in looking at diastolic function, for example, you can hit reverse peak, and now what I'm collecting data on are the lower peaks here. You can also hit the all curve button here. What this is doing is it is displaying all of the curves on the graph. If there's data that I choose to exclude or areas of the heart I don't care about, I can remove that from my data by unclicking the different regions here. And I those back by just clicking them again. So the next thing I want to mention is exporting data. So for this particular snapshot here, what we're looking at, you can export the picture. So if you put your cursor over this button here, you can export any of the pictures you see in JPEG, B, or TIFF. You can also export the data. So if I click on this button, it'll give you some options to do all curved data or just displayed curves. What you can also do is export the graph to the Vevo report. Now, if I click this button, what this is going to do is it actually takes a snapshot of the screen that you're looking at, and it'll put it in the Vevo report for reference. So I'm going to go back and show you how to export data from our previous screen. So our first analysis screen. So to export the data, again, you export this in AVI format, and it gives you options here. Also, you can also export pictures, again, giving you the same options for export. Or export the data. So you can all the different curves. And then finally, again, you can export this to the report. And again, they'll give a snapshot of the screen you're looking at. So that's everything for today, going through the demonstration of the VevoStrain software. So at this point, I would like to open it up for any questions.
Okay, thanks very much, Stephanie. Stephanie, I have one question for you. I know that a lot of people ask about how to get the proper image for doing the VevoStrain. Do you have any information about how to get sort of the best image to start with your VevoStrain analysis?
Absolutely. So when you're acquiring an image, it's important to, especially for VevoStrain, to use the highest frame rate as possible. So we recommend capturing a frame rate at about 200. So this can be done by adjusting your image width. So you can, because the analysis isn't really looking at any of the atriums or the aorta, you can kind of try and exclude that area and make the frame rate and the image as tight as possible around the left ventricle to get a high frame rate.
Okay.
And one other option too is you can look at the dynamic range. If you can adjust the setting to approximately 60, it'll give you a good contrast for your image.
Okay. Good. Just a question about from one listener about what image view is needed for circumferential strain. I think you mentioned this, but maybe just if you could just review that.
No problem. Yep, I mentioned this in the presentation, but it's a really great question a lot of people ask. So again, if you're wanting to get that circumferential data, make sure you're in the short axis view. Okay.
There's a question here about X-Bing, and you mentioned CSV. The user's just wondering how do they use the CSV data?
Sure. So what CSV is it's a data that can be exportable in Excel and any other spreadsheet or software programs.
Okay, great. In terms, there's actually another question here about the Vevo report. So this is the report mode that's used on the VisualSonics software, and is the VevoStrain data compatible with that?
All right. So when you want to again export into the Vevo report, as I mentioned, this is taking a snapshot. So it's giving you reference to the analysis of this heart. So get a screenshot. It can be taken into the report just as a quick reference.
Okay. Okay, good. There's another question that's just come in of the depth of anesthesia and what sort of effect does that have on the strain and strain rate?
Right. Well, you'll want to make sure anytime you're imaging, capturing your images, that you'll want to have the physiological conditions as normal as possible. So keeping your heart rate between 5 and 600 beats per minute is good. As the animal becomes deeper in anesthesia, you'll know that will affect cardiac function. So try and keep your anesthesia to a point at which the animal is as close to physiological conditions as possible.
Okay, there's one other question here about why would someone use, here we go. Why would someone use time to peak analysis rather than the standard analysis screen? So you went through both of those methods, and sort of what would be the motivation to choose one or the other?
Yeah, sure. So the standard analysis will give you an overall picture and information about the myocardial function. But what time to peak gives you is the information about synchronicity of various regions of the myocardium.
Okay. There's another question on types of organs that can be imaged with VevoStrain. So you obviously showed a lot of applications in the heart, and this user is wondering about other organs.
So our VevoStrain software has basically been optimized for heart or cardiac motion. So it probably isn't really going to work for, at this point, any other static organ, so for example, the liver. But we're definitely in the developments for looking at vessel and wall movement to look at strain and strain rate.
Right. Yeah, if I could just comment on that, vessel strain is something that Stephanie mentioned in her presentation. It's not a full-fledged product at this point, but it is something that's on our development roadmap at VisualSonics to try to implement some of those VEC that were shown by that early study by one of our friends and collaborators. So if you have any more questions about that, you can certainly contact us with, and I can get you more information about sort of the timing and release of such that software. There's one question that I did see from the audience that we'll have to follow up. It was just a little unclear on it was asking about apical views, so I think it'd be better if perhaps Stephanie followed up with you directly on that one. Just looking to see if there's the other questions that are coming in. There's one question here on asking about radial, longitudinal, and circumferential, and what is more sensitive. It's a question. I think Stephanie are both and I looking at each other trying to figure this one out. I think it's to say it's really going to depend on the animal model that you're looking at. Depending as far as the imaging itself, the ultrasound image is based on the speckle pattern in the view that you're looking at. So there's nothing inherent in the software that would make one of them more or less sensitive. I think it's more a question of the particular anatomy and disease state of that animal. I'm just going to sort of got quite a few questions here, so we're just trying to get caught up. The question about can we use VevoStrain for measuring aorta sensibility? I think that ties in, Stephanie, to the last question we had about different organs.
Yeah.
So really, it's not optimized for other vessels, but certainly, if you do have more questions about other vascular structures, this is where the vessel strain would play a role. This is something, as I mentioned, on the roadmap for the coming year. We anticipate some release of this probably within the first half of the year, but towards the second half of the year. So if there is more follow-up required, please email us at info@visualsonics.com. Just bear with us. We're just looking. There are some questions being typed in. Yeah, here's a good. Just what exactly are the vectors representing? Are they just the points on the endocardial wall?
What you can do is you can also select epicardium. So there's that. If you look under all of the different selected areas, for example, okay, here. So what you can do is select epi, and what that's going to now do is change the vectors to looking at epicardium. So I'll play this image here. So now an epicardium, and what they're looking at is it shows you the magnitude and direction that those vectors are showing. It's showing you the direction of movement and the magnitude of that direction. So again, to get those to go onto epicardium for analysis, over at the bottom left right-hand corner, I apologize, you just hit epi. So if you an option, it's endo 1, which is now tracking the endocardium. You can select epi 1, and now it's going to show you the vector or the movement for the epicardium. And again, you can now collect data for the epicardium by selecting that button. That's a very good question. That's a good one some people sometimes miss. This is a great question. There's a question that's been asked about getting sternum shadow in an image. There are ways to try and move around the sternum to acquire a better image without causing shadow. So what you're going to want to do is you take the imaging platform. You can do two things. You can take the imaging platform and tilt that slightly down to the left, and put the transducer over the side of the chest so it's eliminating, not right over top of the sternum. Or again, you can change the angle of your transducer. So by just doing these small manipulations, you can avoid the sternum. So if you're right over top of the sternum, yes, that's going to cause a shadow. But begin to slowly move the transducer onto the side of the wall of the mouse on the chest wall, or again, try tilting the platform slightly to the left, and you'll definitely get a much cleaner image of the endocardium.
I think in the interest of time, I do want to keep things on schedule. We've been running about 45 minutes. I hope we've gotten all the questions. I can see there's probably two questions that we weren't able to answer today. But what we can do is we will follow up with you directly via email after the webinar. I do thank everyone for their time, and I especially thank Stephanie for her time. You can email us at info@visualsonics.com. If you do have more particular questions about today's webinar, you can also email myself or Stephanie directly. My email is aneedles@visualsonics.com, and Stephanie is sschaefer@visualsonics.com. Just a few reminders before we sign off today. We will be sending out an email with a recording of today's webinar, and also a survey that we'd love if you would take the time to fill that out and give us feedback both on the content of today's session as well as any other some other feedback about our products and what we offer to you. Again, just a reminder, there's always these, every month generally there's these webinars that are coming up, so please check out visualsonics.com/webinars to get information about upcoming talks that we will be giving. That's all for today. So again, thanks very much to everyone. I look forward to speaking with you in the future. Take care.